Hello YouTube, I'm Dr. Fox. Today, I'm gonna talk about birth control implant. There are two types of long-acting reversible contraception or LARC, the intrauterine device or IUD, and the birth control implant. The implant is a thin, flexible plastic stick about 4 cm long, which is inserted under the skin in your upper arm. First of all, how does the birth control implant work? The stick gradually releases a hormone called progestin into your bloodstream, which prevents pregnancy in 3 ways. The most important way is that it stops you ovulating, so you don't produce eggs. The second way is that it thickens the cervical mucus, so even if you do ovulate, it's less likely the sperm can travel up the uterus. And thirdly, it makes the lining of the uterus thinner, so even if the egg is produced and fertilized, it will probably not be able to implant or stick in the womb. Okay, you may wonder, how is the birth control implant inserted? You have to go to the doctor to get the implant inserted. The doctor will anesthetize a small area on the inside of your upper arm and use a special tool to insert the implant. This usually takes just a few minutes. You may also wonder, are long-acting reversible contraception methods effective at preventing pregnancy? My answer is yes, very. They last for several years. The implant lasts for 3 years and the IUD lasts longer and are easy to use. During the first year of using a long-acting reversible contraception method, fewer than 1% of women get pregnant, and long-acting reversible contraception methods have been shown to be 20 times more effective than contraceptive pills or the partner ring. Then, how are they reversed? Both methods are easily reversed if you want to get pregnant or change to a different contraceptive. To have the implant removed, visit the doctor and they will anesthetize a part of your upper arm so they can make a cut and take the implant out. This usually only takes a few minutes. Okay, question. Will using an implant protect you against sexually transmitted infections or STIs? My answer is no. If there is any risk of getting an STI, including HIV, you must use a male or female condom as well as the implant or IUD. Remember, your risk of infection goes up if you have multiple sexual partners or a single partner who himself has multiple partners. It is also higher if you or your partner already has a history of STIs or an intravenous drug user. Okay then, what are the benefits of the birth control implant? There are several benefits. Firstly, it is very easy to use because once it has been inserted, you can't forget about it for 3 years. It is also very discreet because no one except you needs to know it is there, as it can't be seen, although it can be felt. Unlike hormonal birth control methods, you can use the implant immediately after you have given birth or while you are breastfeeding, as well as if you have just had an abortion or a miscarriage. You can use it even if you are taking other medicines. It can reduce period pains, and if you decide you want to try to become pregnant, you can easily get the implant taken out and your fertility will go back to normal. On the contrary, are there any possible side effects to using the implant? You might see changes in your menstrual bleeding. For example, your periods may become less frequent or even stop, or become heavier and more frequent. Stomach or headaches and breast pain are possible, and some women put on weight and get spots. Also, very rarely, the doctor will have difficulty inserting or removing the device. Furthermore, if this type of birth control fails and the woman gets pregnant, she has a slightly higher chance of an ectopic pregnancy. So if you are using this type of contraception and think you could be pregnant, it's very important to see your doctor as soon as possible. Okay, thank you for watching. See you soon.